Welcome back. My name is David Kernick. This is the fourth discussion in our series on migraine. I'm the lead GP for headache in the Royal College of General Practitioners. I'm here with Professor Macgregor and Alison Frith of the City of London Migraine Clinic. We talked in our last video a little bit about the migraine mechanism itself and how things trigger the migraine centre and how things can alter the threshold of the migraine centre. And in this section, we're going to think a little bit about management of our lifestyle and management of triggers, how we might alleviate the impact upon triggering off a migraine. And Alison, I wonder if I could start with you by asking you, what is your approach to looking at triggers and lifestyle advice when someone comes to see you in the clinic?
At the clinic, we don't normally say to people what triggers your migraine. We tend to say, how many triggers do you have? Because triggers can often add up to tip you over a migraine threshold to actually develop a migraine attack. So there can be a number of different factors, but it's very individual. There are some people that don't recognise triggers at all, and there are other people that do. So it's working out for yourself if there's something in your life that maybe you can do something about. And as we were saying earlier, routine is very important. So things like eating regularly can be very, very important, getting enough sleep, keeping hydrated, because if you don't do those things, you can tip over this migraine threshold and develop an attack.
And exercise, is that important, do you think?
Exercise can be important. If you're generally healthy and get exercise, that can lower your threshold, but you do need to be very careful to make sure that you're hydrated and that you keep your sugar levels stable while you're exercising, because you can find that exercise can trigger an attack, and some people with migraine will avoid exercise because they believe it triggers attacks.
It seems everyone's looking for this, quite understandably, this secret trigger. You know, they go for years looking, they're trying different diets and different, but it very rarely exists.
It very rarely exists. There's no single trigger or single food. If it was that simple, we wouldn't need to have migraine clinics. Yes. It is really very individual. Triggers can change, and they may not be relevant for people at various stages in their lives.
And there's all sorts of triggers that we recognise, and I think we were talking about how migraineurs don't respond to changes so well. I'm always interested in how people respond to changes in the weather. Obviously, we'll be talking about menstrual changes and hormonal changes in women a little later. What's your perspective on triggers, and how far do you go exploring triggers with patients when you see them in clinic?
Trying to find out, you know, when asking people their story about their migraine, what they feel is relevant. I mean, we use diaries an awful lot in this clinic, because they can help people identify, are they more likely to get attacks at weekends, for example? Are they more likely to get them at times of hormone changes with their periods? Is it following, you know, going swimming on a Thursday evening, or after a child's, you know, intense Saturday morning football? Those sorts of things, trying to look for patterns. And it is very difficult to give people a list of potential triggers, which can, you know, be this sort of long, include an incredible number of different things. And it's recognising that people need to balance things up. So one of the focuses that we will lead people to is not what can't you do, what do you need to avoid, but if you're in a particular situation that you want to carry on doing, what do you need to do to balance it up? So for example, if you're going to be doing intense exercise, Alison already mentioned you need to make sure that you are well hydrated and you find ways to maintain your blood sugar. You don't suddenly go into deciding that you want to do intense exercise when you haven't built up to it. So, you know, a marathon runner wouldn't go out and suddenly run a marathon. They've got to start off slowly and build up. And people would tend to jump into doing something with great focus and, you know, great enthusiasm, but actually do it too hard at the beginning. And things like with the diets that people follow, people tend to worry about certain foods, and we say to people, if you haven't identified a specific food that every time you eat it you're going to get a migraine, what's probably far more important is making sure that you eat regularly. And people will then say, but I followed this particular diet and I felt better, I followed that particular diet that excluded X, Y, Z and got better. It may be that when they're following the diets, they're just eating regularly for a change. And that's much more important.
I think regularity is a key thing, but the trouble is in this day and age it's very important to do, isn't it really? We've all got busy lives and we've all got different schedules and some people are working shift patterns. It's very difficult to keep a regular pattern.
But we wouldn't try and drive a car without any petrol in it.
No,
it's just making simple things.
Yes, and of course this is more important in children who seem to be more sensitive to changes and things, and they often go without, particularly young girls go without breakfast, they snack during the day and it's usually junk food, so I think it's particularly important in children as well.
And sleep routine as well, particularly
Yes.
in children who are now up on their computers or up at all hours, because a family's routine is very different then.
Okay, so there's quite a lot we can do to help ourselves to lower or raise the threshold for the migraine centre, but inevitably we're going to be needing some sort of medication, and we'll be looking at that in the next section. But before we do that, I'd just like to spend a minute or two thinking about other areas of medicine that go with other disease processes that go with migraine. And we know that certain diseases are more common in people who suffer with migraine. We know, for example, that epilepsy is more common, asthma, irritable bowel disease is more common, anxiety is more common. But I think the most important thing from a clinical perspective is recognising that a lot of migraineurs get depression. And in fact, if you have migraine, you're almost up to 4 times as likely to get depression as a non-migraine sufferer. The reason is not well understood, but it probably is acting both ways, and I wondered what you thought about that, Anne.
I think arguably also there may be just fundamental chemical differences. We were talking about the different brains with migraine, and it may be that we're also seeing different chemical aspects with the associated depression as well, so that people who have migraine may be born with a brain that is less able to produce the chemical that alleviates depression. And if you've always been depressed, and I'm talking about it at a comparative level to people who don't experience depression, you wouldn't actually know it, because you wouldn't know what it's like to not be depressed. So you've developed your own normal. But we know that that level of normality is that much lower in people with migraine, so that we would record them as having depression even though they may not recognise it in themselves.
And of course there are important implications for treatment, because a lot of the drugs we use in migraine can make depression worse. Some of them are quite beneficial in depression, so it's quite important to identify whether anyone is suffering from depression, not only to treat it, but it also implications for how we're going to manage the migraine.
Yes, we've noticed as well when we've treated depression in patients with migraine is that it may not necessarily reduce the frequency and severity of their attacks, but their response to migraine changes. They feel much more positive about coping with the migraine. And in the long term, that can have benefits for managing the migraine in itself.
Yes. Okay, well thanks for that. I think what we're going to do now is move on to looking at the management of migraine. We're going to start with looking at the management of the migraine attack itself.